Hello everyone, my name's Nadine Hawash. Welcome to today's How to Save a Life lecture. I just wanted to create this today as a taster session for you all into medicine. So just to introduce myself to start off with, so I'm a medical student at the University of Manchester and I'm currently undertaking a MB PhD in cancer sciences for 3 years. This is where I'm taking 3 years out of the medicine course to undertake some research into cancer sciences, specifically looking at cancer and obesity. So to go into my journey through higher education. So I am at the University of Manchester. Before this, I did biology, I did chemistry, physics, Arabic, and all these were A level. And I also did a EPQ, which is an extended project. And I did this extended project on a medical topic called thalassemia. And this is a blood condition, usually in the Mediterranean. So this was my A levels, but when I was in my A level times, it wasn't that easy. And it sounds like it's easy when you present it to everyone, but I did struggle and I found it was hard, I have to admit. And I did have challenges with it. Equally, I tried to tailor my studying and find topics of interest. So I was interested in medical sciences. And so in physics, I did my coursework on a medical related coursework that involved physics, so proton beam therapy. So there's different ways that you can use your A levels to help you to learn more about a topic of interest that's not necessarily specific to that topic. And so these were my A levels, but yes, it was a hard time to learn for me. And I didn't actually get into so I was thinking about medicine, but I didn't get into medicine. And in fact, I actually got into foundation year biomedical sciences. And this was an incredible opportunity for me to learn and develop, and both academically and personally. And I was very grateful for this foundation year because it helped me learn more and have the baseline knowledge I needed. And then I went into first year biomedical sciences. After that, I actually had a opportunity to transfer, so to go from one degree to the other, and that was to transfer from biomedical sciences to medicine. Now, I want to just differentiate the two. So biomedical sciences is usually more of an academic aspect to sciences, where in medical sciences, where you can learn about genetics, you learn about molecular biology, you learn about really specific aspects in medical science. With the difference between biomedical sciences and medicine, what I found is that in medicine, you have the medical knowledge that you need and that you need to treat patients, but you also get the opportunity to speak to patients, and you get to see patients on a daily basis and examine these patients. With biomedical sciences, it's a degree where you can end up in the labs, you can end up in business if you wanted to, you can end up, I mean, there's many opportunities for where you can end up with it. And you can also go into industry as well. So there was a differentiation between the two, but I found that medicine was what I wanted, so I transferred. I did first year, I did second year, and I did third year of medicine. And then it came to an opportunity that I got recently, and this was to undertake 3 years outside of medicine to do a intercalated PhD, which means doing a PhD, a postgraduate degree, in between my medical education. So in the long run, what this means is that I'll be able to graduate both as a doctor, a medical doctor, a clinician, and also as a clinician scientist, where I can get involved in research alongside practicing as a doctor. I appreciate that my route through higher education isn't the straightforward route some people take. Some people will go into years 1 to year 5 of medicine, or years 1 to 3 of biomedical sciences. But I hope that by explaining this to you today, it shows that there's multiple opportunities um, for, I'd like to say, growth, but also multiple opportunities to get involved in higher education and to pursue the dream that you have um, in in university. And what I found is that, especially at Manchester, they are very welcoming to widen participation of students. And that's why I'm here today to speak to you. But it's to show that there's plenty of routes into medicine, into biomedical sciences with the foundation year. And, you know, what I found, the underlying message here is commitment to studying and being inspired by the profession, and, you know, trying to climb up and up and up to get to the goal that I have um, helped. And that's something that I hope I can tell you today, that there is multiple opportunities in higher education for you. So please believe in yourself and go through with them. So, just to give you some idea into what I aspire to become in the future, I aspire to become a doctor once I graduate and after doing medicine. And I also aspire to become a researcher. And this is why I'm doing a PhD to become a clinician scientist as well as a doctor. And I'd also look forward to becoming a surgeon. This is where, after I've completed medicine, I will be doing specialty training into surgery. So this is who I'm, this is what I aspire to become. So like I mentioned, thank you for attending today's How to Save a Life workshop. The topics discussed today in this workshop will be about how to respond to an unconscious person in the street. So I'll be giving scenarios to you all today, and this is one of them. And it's about what would you do in a situation where there's an unconscious person in the street. And the second scenario is how to deal with someone that's choking. You see someone, how would you deal with it? So I want today's session to be very interactive, and I want you to hopefully feel relaxed enough to speak to one another and discuss your ideas. You know, no one's expected to know the answers at this stage. Just to give a bit of disclaimer to today's session, this is not a training session whatsoever. This is just to provide a taster into what being a medical student, what you would learn, just first aid in ways that you respond if you saw someone in the street. And it's just to give you a taster and hopefully inspire you into the subject above all. So it will be just discussing these different scenarios. Okay, so let's get into it. So hopefully you're all in either a group or you sat around a table, or you've got somebody next to you that you can talk to whilst we do this. So first of all, what I want to talk about, imagine yourself as a newly qualified doctor and you're on your way to the GP clinic this morning, but you notice that a middle-aged man collapsed near a busy road. What would you do? Okay, so you're a newly qualified doctor, you're going on your way to this GP clinic, and you notice a middle-aged man collapse near a busy road. What would be the steps that you take? I'd like to ask your teacher to pause this for 3 minutes, allowing you to discuss between one another. If you've got a pen and paper next to you, write down some ideas. What steps would you take in this situation? You've seen this person, bearing in mind it's near a busy road. What would be the first thing that you do? Okay? Okay. So hopefully you've discussed this between each other. And I want to try and give some options to see which ones you would take. So would it be A, you'd run straight towards the collapsed man, and you would want to see if he responds. First thing that you do, you just run straight towards him and see if he responds. Or would you check to see if there's any nearby danger before you go and approach the person that's collapsed in the road? Or would you, you know, you're a newly qualified doctor, You're on your way to the GP clinic that morning. You don't want to be late. Would you just go straight to the GP clinic and act like you didn't see anything? What would be the option you'd take? Is it A, responding as soon as you can, B, checking for nearby danger beforehand, or C, acting like you didn't see it and going straight to your GP clinic? Okay. So the answer is D, danger. So that is B on the question there, sorry, but D for danger. So danger. First, what you want to do in any situation where you see a person that's in the middle of near the road and near a busy road, first ask yourself, is it safe? Is it safe to approach this person? Is it safe to, considering that it's a busy road nearby? Would you be putting yourself in danger beforehand? Okay. And then you'll be asking, will you be putting others in danger? Okay. And when we say danger nearby, this could be a busy road with cars, like we had in this scenario, or it could be nearby river, or it could be exposed wires, electrical wires that are exposed. So there's different types of danger. Okay, so first, am I safe? Is the person safe? Is there anything I need to be aware of first to assess the danger of the situation? So number one, D for danger. What would you do next? Okay, so you've seen a patient, the person that's collapsed by the nearby road. It's a busy road. You've checked and you've seen that it's safe to do so, that it's safe around for you and for them. What would be the next step? If you'd like to pause for a minute, that's fine. Okay, so what we want to do is we want to see if the patient is responding. I refer to the patient in this, but I mean the patient is the person in the road. So the person in the road, the man in the road, you want to check if they're responding. So, hello, can you hear me? Okay, we want to say that. We want to say that loudly. What we want to do is say it in both ears. Hello, can you hear me? Hello, can you hear me? Just a quick question. Why do you think we shout it, like we say it really loudly in both ears? Why don't we just say it in one ear? Just a quick question. If you'd like to pause to think about it, and I'll say the answer now. So the reason why is because maybe the patient is got something blocking their ear, or maybe they're deaf in one ear. Okay, so we do it in both ears, or maybe the hearing aid's fallen out. So you do it in both ears to make sure that the person actually can hear. But the patient may not be, may not have a hearing ability. So we want to also make sure that we shake the patient. We want to shake them gently, okay? And we want to see if they respond. So first we check the danger of the situation, then we check to see if there's a response. What would you do next? You discuss between yourselves? Okay, so the answer is to send for help. So the way to do this, first of all, look around, see where you are. If you're in a nearby busy road, are there passers-by? Are there people that can speak, that you can tell, that you can shout to? Shout for help. Okay, look around, see if there's anyone. Okay. Some people say call for 999, but there's two instances where you can do this. So after you've looked around, checked there's no danger, checked there's no, the patient is not responding, then you've gone and you've shouted for someone to get help. Okay, what would you do next? First of all, what we want to do is we want to check the airway of this person. Okay, the way to do this, so the airway is like a long tube from the mouth all the way down to the lungs. And the reason why we want to do this is to make sure that the patient has not got anything blocking the airway. So we make sure they laid on the back, and we want to lift the chin up and push the head back. So I'm going to just demonstrate on me. Put your palm of your hand on your forehead, on the patient's forehead, and you put your hand on the chin and you push back. And from doing that, when they lay on the floor, that will allow for you to get a clear view of the airways and that there's nothing blocking. Okay. And check to see if there's anything blocking. Don't try and put your hands through because the person can bite and you don't want that. Okay? Then the next thing to do, what would you do next? So I just want to give you some time to think. So you check for breathing. So you want to check to see if the patient's breathing, okay? So if you can hear the breathing, so can you hear a sound or can you feel it? So if you put your chin near the patient's head, they lay down, just put your ear like that to hear the breathing, but you may be able to feel it on your cheek. Also, whilst you're doing it like that and the patients lay here, so if a patient's lay here and you do this, then you can see the chest if it's going up and down. If it's doing that, means the patient's able to, breathe in and out, okay? Because we've got muscle that's moving the air in and out. So we've checked the danger, we've checked to see if the patient's responding, then we've gone and shouted for help, then we've checked the airway, we've pushed the head back, and now we've checked the breathing. Okay. What would you do next? So we've checked that they're breathing, they're not breathing. You'd want to do, so C stands for two things. Calling for help, so you have to go and physically call 999. So you'd have to leave the patient at this point if there's no one there that's around you, or find help if there is someone. And the second thing that you'd have to do is starting chest compressions. Now, because this is a virtual talk, I will be showing you a video at the end of how to do this by St. John's Ambulance. But for the time being, just to explain it. So you can see the diagram there of a visual of a heart and the hands being like this, okay? So it will show it better in the video, but you press down hard for 30 times, okay? And you do 2 per second. And the reason why we do this is to ensure the blood is still being pumped up to the brain, okay? And you keep doing that until help arrives. Okay, so what would you do next? So we've done these chest compressions and we've also need to do the rescue breaths. So you do mouth to mouth and you blow twice after pumping 30 times, okay? So I just want to stop here because I know it's quite a bit of information. And just to go through it, because I will do it at the end as well, checked for the patient's collapsed in the middle of the road. Checked for danger, there's no danger. Checked for a response, no response. You have shouted for help. A, airways. There's nothing blocking it, okay? Breathing, no breathing. C, checked if the heart's you've called for help and you've also started chest compressions, which is pressing down for 30 times. And you've also done 2 rescue breaths, okay? What would you do after that is this machine. Now, this is D for defibrillator. Sounds complex. So it's called an AED. And what it means, it's quite nice to actually know what it looks like, because in a situation, this is probably something you want to find. This is a automated external defibrillator. It's a long word, but what it means is the way it works is it will check the rhythm of the heart. So check whether the heart's beating regular, a normal rate, or irregular, okay? And from doing that, it detects it, so it figures it out, and then what it does, it sends a shock of electricity, okay? So you usually place it around, there's instructions on it, and you can see like a little diagram there at the top, but what it does is it will send this shock of electricity, and this allows for any abnormal rhythms to go back to normal, okay? I'm just trying to show you like the speed. So definitely following the instructions on the device would be the way to do this. And this is the way that we're taught. And also continue on it until help arrives. Okay. So to summarize, now, a good way to learn this, if you were thinking about how medical students learn it, doctors, DRS, ABCD, okay? So, patient that's unconscious in the street, the way to do it, D for danger, checking the danger, is it safe? R for the response, talk and touch. Hello, can you hear me? Hello, can you hear me on either side? And then send for help, for S. A for airways, is it a clear open airway? B, are they breathing? Okay. C, you want to do your chest compressions 30 times, and you want to breathe 2 rescue breaths. So breathing into the mouth twice, and then continue your chest compressions, and then keep going between them. And then D, defibrillator, where we attach the device and we let it do its job and the electric. So doctors ABC. It's a mnemonic to use. Just want to show you this video.
And circulation. So, when I see a casualty, first, I'm going to check for any danger to make sure it's safe for me to approach them. I don't want to become a casualty myself. Then I'm going to see if I can get a response from the casualty. As you approach, introduce yourself. Ask them questions to try to get a response. If they're not alert and do not respond to your voice, kneel down beside them and gently shake their shoulders. Hello, Amy. It's Winston. Can you hear me? Open your eyes. Still no response? You can pinch their earlobe to see if they respond to pain. Depending on how the casualty responds to you, will establish a level of response. We use the AVPU scale, and each letter can represent the casualty's level of response. A, alert. V, response to voice. P, response to pain. And U is the casualty unresponsive to stimuli. If there's still no response, they are unresponsive. We need to check the airway. Is the casualty alert and speaking to you? You know that there's no problem with the airway, it is clear. If the casualty is unresponsive, open the airway by putting one hand on the forehead and gently tilting the head back with 2 fingers under the chin. Now we need to check to see if they are breathing normally. We do this by placing our ear and cheek over their nose and mouth, looking down the body to see if the chest rises and falls. We do this for 10 seconds. If the casualty is not breathing normally, call for help. Ask them to call 999 or 112 for emergency help and bring an AED. If you are alone, call for emergency help using a mobile on speakerphone and begin CPR with chest compressions. The casualty is breathing normally, so I'm going to check their circulation. Are there any signs of severe bleeding? Look and check down the body. If you find severe bleeding, try to control the bleeding to prevent life-threatening shock. Call 999 or 112 for emergency help before continuing to treat the casualty. You may also need to treat them for shock. I've established that my casualty is not bleeding. So remember, to do a primary survey, follow the order of Dr. ABC. Complete each step in that order as quickly as possible.
Okay. So hopefully that was helpful, because it's easier to see it on a model or on a person. And what doctors say is that it's different in real life and how it feels as well than the dummies that they use. So I just want you to give it a minute and just to reflect on how you thought that went and what you thought, whether or not that was the same as the approach that we're taught to use doctors ABC. Did you run into the situation and check if they're responding before checking for danger? Or that's a common place where people often get it wrong, to be honest. Which is fine, because that's an instinct that we have, but I think it's always important to checking around and checking the danger. Okay. So hopefully you enjoyed that, and the video is useful for you as well. Okay. So if your teacher would like to pause for a minute for you to reflect. Now, a little quiz. You've got 3 minutes as a group to write down what each letter stands for, okay? So this is the mnemonic that we used just now. So do you remember? So if you have a pen and paper at the ready as a group, go through. Do you remember what D stands for? R, S, A, B, C, D. Okay? Let's see how many you get right. So if you pause now. So let's see if you got it right. So D, danger. R, response. S, shout for help. A, airway. B, breathing. C, circulation. For the chest compressions and calling for help. So I'll give you a couple on that one. And D, an AED, so defibrillator. That's quite a tough one. Don't worry if you didn't get that. But good job, everyone. Thank you for participating in that. So our How to Save Life workshop continues. In our next scenario, you're a newly qualified doctor on holiday in Italy. You're enjoying your holiday away from work, but you notice that the person in the table opposite to you starts to choke, okay? So you can see them go, starting to choke. What would you do? Okay? So you're enjoying your time, you're off work, you're not on work anymore, and you're just eating, and you're enjoying your pizza. What would you do? So, would you A, get the person that's choking to start to cough? Would you encourage them to cough? B, ask the person choking to speak? C, slap the person choking on the back? Or D, continue eating your pizza? You're on holiday. So, think between yourselves if you want to pause right now and ask yourself what the answer is. So, the answer is if the airway is partially blocked. So you'd first want to see if the person is able to speak, cry, cough, or breathe. So you check that first. You want to check to see if they have got an airway that's partially blocked. Okay. So the way to work that out is if they're speaking, or if they're crying, or if they're coughing or breathing. That'll be the answer. Okay. So going back here, the answer was ask the person choking to speak, or see if they're speaking, or see if they're coughing. So you could probably get both on that one. But really you want to check first to see if the airway is partially blocked. So just a bit blocked, okay? Because air can still flow a bit when you're able to speak, cry, cough, or breathe. Right, so what would you do in this situation? The first thing that you do is you'd encourage them to cough to clear the blockage. So you see somebody choking, encourage them to cough. Ask them to try and spit it out as well. If it's an object that's in the mouth, ask them to spit it out. But make sure you don't put your fingers down the mouth to try and help them, because they could bite your finger off accidentally, okay? And you wouldn't want that. You're on holiday in Italy, so no fingers in the mouth, okay? So encourage the person that's choking, that's now your patient, to cough, to clear the blockage, and ask them to try and spit it out. But no fingers in the mouth. And what happens if they can't cry, or they can't speak, or they can't cough or breathe? 5 back blows. Okay, give them 5 back blows on the back to try and clear the blockage. If that doesn't work, give them 5 abdominal thrusts. Abdominal means tummy, so 5 tummy thrusts, okay? And I'll show you a video on that. It's quite hard to see me at the corner there. So,
if you think an adult or child is choking, ask them, are you choking? Cough it out. If they are coughing, encourage them to continue as they may be able to remove the obstruction. If they're unable to speak or cough, they need your help straight away. If coughing doesn't work, slap it out. Support the upper body with one hand and help them to bend forward. Use the heel of your hand to give up to 5 sharp back blows between their shoulder blades. Then check to see if there's anything in their mouth. If there is, tell them to pick it out. If back blows don't work, try giving up to 5 abdominal thrusts. Squeeze it out. To give the abdominal thrusts, stand behind them. Put your arms around them and link your hands between their tummy button and the bottom of their chest. Clench your lower hand in a fist, grasp your fist with your other hand and pull sharply inwards and upwards. Repeat up to 5 times. Check their mouth. If they're still choking, call 999 or 112 for emergency help. Use a speakerphone if you can. Keep repeating the 5 back blows and 5 abdominal thrusts until the blockage clears or help arrives. If they become unresponsive, open the airway and check their breathing. If they are not breathing normally, start CPR. So remember, if someone's choking, cough it out, slap it out, squeeze it out. If it's not cleared, call 999 or 112 for emergency help. Keep repeating the cycle. Start CPR if they become unresponsive, and that's how we treat choking. If this video has been
so thank you for St. John's Ambulance, because they are very good videos for you to see that there. Okay, so how did you get on? How did you feel in that scenario? Were you able to, do you feel confident that you understood the scenario well? Do you feel that you thought the right way, or did you think differently? How did you get on? Just take a minute to reflect. So, quiz time. So in between, you just ask yourselves, what is the first thing you would tell someone choking that can speak, cough, cry, or breathe to clear the blockage? What would you tell them to do to clear the blockage? What would you encourage? You see someone choking, but you can hear them cry, speak, cough, and breathe. Second question. What are the signs of a blocked airway? It's quite a tricky one, that one. So just pause if you pause the video here for 2 minutes and just to answer these questions. Okay, so the answer to the first question is to encourage them to cough. You need to make sure that you encourage them to cough because this will bring the obstruction, okay? So good job. And the second answer was actually the fact that if you can't hear them cough, cry, speak or breathe, that's likely it's a complete obstruction of the airway. So a complete blockage is just what obstruction means. Yeah, but well done. It was a good job, a good effort. Doesn't have to be a right answer, but hopefully you've learned from today's session anyway. But just to give you a taster, not to train you or, you know, this is not a first aid course, but hopefully to encourage you about what we learn. So I really hope you've enjoyed today's workshop, and I hope it's inspired you and given you some insight into the things that we come across whilst studying medicine, and the different scenarios that you can come across in day-to-day life, really, and how to approach them. So I wanted to give more insight into the road to becoming a doctor and really the path that you can take. So currently you're in high school and studying your GCSEs. And then you'll be going into college. Now, at college, usually, if anyone wants to do medicine, you'll be studying your chemistry, biology, and possibly physics or maths. But each university has different requirements for what you want to study, what you can study, and what they ask for. So I'd recommend when you're thinking about college and thinking about medicine, to keep having a look at the university websites that you're interested in applying to, and have a look to see what they ask for as well. But definitely choose the subjects that you enjoy doing, and just make sure that they're asked for. And then after college, one of the processes of getting into medical school is doing an entry exam. So this would be either a UCAT or a BMAT. I'm just giving you an idea of what the sort of things to expect, but I won't dwell on it too much at the minute. And hopefully you get more information on that in college. And then you go into medical school for about 5 or 6 years. And honestly, take it from me, I've really, really enjoyed it so far. And after you finish and graduate from medical school, you'll graduate as a foundation year doctor, where you'll be working in a hospital and still undertaking training. This will be for about 2 or 3 years. And after that, you'll be considering what specialty you want to go into. And what this basically means is just a specific aspect of medicine that you're interested in. For example, you could be the GP, a general practitioner, or you could be a surgeon, or you could choose to be a pediatrician, or you could choose. There's so many choices that I can't go through them all today, but hopefully I can give you a link. And hopefully throughout your career, your path, this path, that you are inspired by a specific specialty to think about. That's many years down the line. So, in terms of doctors in general, and really any healthcare professional, the skills that are important is active listening, both listening actively to the patient and what their concerns are, but also listening to the people you work with as well. You work hand in hand with nurses, you work hand in hand with physician associates, many people you'll be working with. So it's important to be an active listener, to be caring towards your patients, and also the people you work with. And also, you may experience leadership roles, because usually doctors may take lead on going through, the patient cases for the day, and speaking to the rest of the team about what they're going to do. Motivation is very important as well, because to be a doctor, you're going to be a lifelong learner, and you've got to have that drive, that willpower, the determination, and believing in yourself. Definitely important. And motivation and also helps when you're passionate about what you do. And it does take responsibility, but a lot of things take responsibility. I think with medicine, the more you experience, and the more you learn, the more you're able to take on these responsibilities as well. And teamwork is crucial, to giving good medical care, and also having a lovely time whilst you're working as well. And so, just to give more information into other healthcare roles as well, because in the hospital, anyone that steps foot in the hospital or in the GP practice, or a community worker, is very important, and does so much, that it's important to talk about these roles as well. So, the incredible work that nurses do. Nurses get a lot of patient contact time, and build a very strong relationship with their patients on the wards, and they can give advice about medication to the patients. They can also give more physical care to the patient as well. So they do a fantastic job. And also, there's also different job roles as well. For example, a physiotherapist or an occupational therapist. An occupational therapist can help you to can help patients to look at what their day-to-day life and how they're able to get the patient to be able to adapt back into their daily life. So, for instance, this lady could need the stabilizer to help her mobilize and walk. So they'll assess that and try and give the best um, uh, give the best to their patients. And there's also a physician associate. This is a role that's quite new in the UK. And this is a physician associate works similar to a doctor in terms of they can have diagnose the patients. But one thing that they can't do at the minute is prescribe. But the role is very important on the wards of a physician associate. And you've also got community workers as well. So I hope that's given you some insights. And one thing I want to end off before the summary is just to say that, believe in yourself. If you are passionate about doing medicine, I would strongly recommend that you believe in yourself, because that is a driver to your success. Just to summarize today's workshop, we've talked about, we've completed a taster session on how to handle an unconscious or unresponsive patient with Doctors ABC. So we're checking the danger, we're checking the response, we're shouting for help, checking their airways, their breathing, their circulation. So, and you're also doing chest compression. Circulation just means blood flow around the body. Okay. And D, we're using that device, the defibrillator, which just sends an electric shock so that an irregular heartbeat becomes regular. With the scenario of a person choking, how do we deal with it? So this is where if you see there's a partial obstruction with crying, coughing, or with crying, speaking, or wheezing, encourage them to cough. If they're not and you can't hear anything and it's a sign of a blocked airway, then you want to do 5 back blows and 5 tummy thrusts, abdominal thrusts. So that is the end of today's workshop. I appreciate you all getting involved, and hopefully you have enjoyed the virtual learning. But just to remind you, it is a taster session and not used for personal training purposes. Thank you for listening. If you have any questions, you can ask the teacher. Thank you.